Dr. James Garidi is with Vein Clinics of America, and he's here now with more on the causes of vein disease and some of the new best ways to also treat it. Great to have you here this morning.
Thanks for having me.
You're like, yeah, I'm the guy who has to do the segment with her after she slams a beer, right?
I'm jealous.
Next time we'll hit you up too. Let's talk a little bit about the prevalence of vein disease, because I also want to get to later why people don't notice the symptoms of it. So how common is it?
You know, vein disease is amazingly common. Most studies are going to suggest anywhere from maybe 25 to 40% of the U.S. population probably suffers from vein disease.
And it's really, there really is a spectrum, right? Because it goes to something that's probably more on the lines of being superficial or cosmetic to being quite serious.
Sure. A lot of people think that vein disease is just a cosmetic issue, that you can see the veins, and when you see them, that's when the problem exists. But the reality is that the symptoms of vein disease are very, I always tell folks, they're very generic. My legs are achy and tired at the end of the day. Well, lots of people's legs are achy and tired at the end of the day. Or people will say, yeah, I have some swelling in my legs when I eat too much salt. Or, yeah, I get some cramps at night when I'm sleeping because I'm not drinking enough water. People often have symptoms in their legs that they think are related to other issues, when in reality they're related to vein disease.
Now, that statistic that we talked about where 50%, so we're talking about half the people who have this disease are not even aware that they have symptoms or that they have a problem. Why is that? Is it because it's so kind of generic in nature?
Absolutely, yeah. Most people, like I said, most people have arthritis, let's say, and they'll assume that the pain in their ankle or the pain in their knee is because of arthritis or tendonitis or, again, bad shoes. They'll come up with the thing that they've been thinking about for a long time and often ignore the possibility that veins are the cause.
Okay, so let's talk a little bit about the options that you have for treatment, because there are some new ones that I think should be very encouraging to people to help correct this problem.
Yeah, and that's been one of the real big issues. Is in the past, people thought you had to have surgery, be in the hospital, be down and out for a while in order to have...
Well, people have heard of stripping veins.
Absolutely, yeah. And most of anybody who's had stripping or knows somebody, it's been a painful experience, so that scared people away from even considering it. So nowadays, the things that we do are done in an outpatient setting, so in an office. I always tell folks, I do poke you with needles, but no cuts, there are no scars, you can be back to work the same day. We use a combination of lasers and injections, and again, I always tell folks it's something, but in the grand scheme of life, it's a very, very tolerable batch of treatments.
And how effective is that? Because is there, you know, because you're not doing the incisions and you're not doing the stripping, is it a problem that often comes back? How effective is the treatments that you can do in office?
Yeah, another great question. The biggest challenge with doing stripping or surgical procedure is you can only grab onto and pull out the vein that's big enough to grab onto and pull out, so you tend to leave a lot of stuff behind. So recurrence rates with the surgical procedures are probably much higher than with the non-surgical procedures. You can be much more comprehensive. We typically suggest that for most procedures you're going to see maybe a 1 or 2% recurrence rate, meaning that a vein that's treated might come back 1 or 2% of the time. The tricky part is it is a disease, so veins that are normal today can fail in the future, so the rate of new vein presentation is something as well, and it's variable from person to person.
But I'm sure it surprises people that it's now less invasive, less painful, and a whole lot less downtime, but yet they're actually in a much better condition after you do these new treatments than when they used to do the surgical or the stripping.
Yeah, there's no question. Again, people being able to continue with their normal activities from day one is amazingly helpful for people to feel well during the process, but also to heal the process as well.
What about insurance? Are some of these procedures ever covered?
Yep, most insurance companies have some criteria. There might be some hoops you have to jump through. There might be specific situations, but as a general rule, most insurances do provide coverage for vein treatments.
Which should be a relief for a lot of people. What about the consultation that you do? Because I'm sure a lot of people aren't sure exactly what type of treatment they need to correct their problem.
Sure, and that's the big challenge, again, especially if 50% of the people don't even know that they have vein problems. It's a challenge. So what we do is, for most folks, we'll offer a free consultation. There are some governmental restrictions on that, but for the most folks, we do free consultation. They'll come in, I'll discuss their medical history, I'll examine their legs, we'll do an ultrasound to try to evaluate some of the bigger veins under the surface, and all of that typically is going to be no charge.
And keep in mind, ultrasounds are not painful at all. Women know that, especially if they've had babies, because it's just a scan, but a lot of men who maybe have this problem don't know that. You have an event coming up on May 21st. This is a free open house where you're answering people's questions. It's happening from 5 to 8 p.m. at your Brookfield location. And this is really a chance. I love the logo that you have, Vein Clinics of America, listen to your legs. Great opportunity for people to ask questions.
Yeah, and again, for those folks, excuse me, who have been intimidated by vein treatments in the past or just are afraid of doctors in general, it's a very non-committal, very open opportunity. People come in, we'll have snacks, we'll have some drinks, you can walk around the office. If you're interested, we can do a quick ultrasound of your legs with absolutely no commitment, and at least you get an insight into what everything's like.
Wonderful. Absolutely. And I know right now you're doing complimentary consultations at your Brookfield clinic. So here is the information. Call right now. It's toll free 866-618-VEIN or 8346. You can also visit veinclinics.com to schedule that free consultation. Great to have you here this morning. Thank you so much.
Thank you.